Hi, welcome back to Mayo Clinic Radio. I'm Dr. Karthik Balakrishnan.
And I'm Tracy McCrae.
Recently, fourth-year Mayo Medical School student Paul Stadem was honored by the Minnesota Academy of Family Physicians with the 2018 Medical Student Leadership Award. According to Dr. Stadem's mentor, Dr. Margaret Gill, his bedside ability and work ethic are an inspiring model to students and residents who work with him.
After graduating from the Mayo Clinic School of Medicine in May, he is now Dr. Paul Stadem. And he's here in studio with us today to discuss that award and what life was like as a medical student here at Mayo Clinic. Welcome to the program, Dr. Stadem.
Thanks. It feels really weird, but thanks so much for having me.
I'm sure that your family is just loving it.
Yeah, very proud of me and proud of everyone who went through Mayo and the accomplishments that some of my classmates have had. It's just amazing.
Because you're from just up the road in Minneapolis.
Yeah, I was born and raised in Eden Prairie.
All right,
so.
And that's where you're going after, and that's where you're going to be now.
Yep, I matched into family medicine at North Memorial Family Medicine Residency, affiliated with the University of Minnesota in northern Minneapolis.
So did you always want to be a doctor growing up in Eden Prairie?
No, I don't know when it really started. No one in my family is in medicine, and I always thought I was going to be an astronaut because I thought that space was just amazing. But I think as I went through and learned more about being a physician and caring for other people and discovery, I mean, I think that's really what a lot of people go to medical school for, is like the caring and discovery stuff. So that's kind of what led me to where I was.
So can you tell us a little bit just about this leadership award and what it means and how you learned about it?
Yeah, so in medical school, I came in pretty interested in primary care just because it seems to be in line with some of the things that I was passionate about in coming to medical school. And so I got really involved with family medicine because that's kind of one of the main specialties that is guaranteed to deliver primary care. And so with that, I got really involved with the Minnesota Academy of Family Physicians and took up some leadership roles there, student director, and sat on the board of directors of the Minnesota Academy of Family Physicians. And through some of that work, I kind of started to learn what the policy and the education and the clinical aspect of primary care was like. And I think that's probably what lended up to me getting nominated for the award, and also kind of being a family medicine interest group leader here at the Mayo Clinic.
Having physicians who want to go into family medicine is a great deal. From other interviews that I've heard, lots of people want to specialize and they don't think about family medicine as an option.
Yeah, I mean, I think it's definitely an option. I think that's one of the great things about the state of Minnesota is, as a state, we produce some of the most family medicine physicians per medical school graduate, and it's largely is coming from the University of Minnesota. But there's 2 of us going into family medicine this year at the Mayo Clinic, and I think it's a great specialty. I'm excited to join the field.
So tell us about what life is like at going to medical school at Mayo Clinic.
It's hard to explain because it's just wonderful. I mean, it's very wonderful. And I think that one of the things that sums up what life at being a medical student is like is you're really, the needs of the patient come first. And you see that day in, day out in your clinicals. But also, Mayo Clinic is a world-class education institution. And there were so many times during my education that I was asked, not just what do I think about this medical nugget of knowledge or what have you, but how is this beneficial to your learning? And I think that when you are a medical student in that type of environment, that's non-threatening and not malignant and very encouraging to making mistakes, that it actually builds a better physician. And for me, that was really important. One of the things that I was excited about when I was coming here. I got that during my interview.
Is there like a moment maybe that you recall from your medical school experience that really stands out to you as like a treasured kind of experience for you?
Let me think.
I would say terrified, but whatever.
So one of the experiences that that is kind of just burned in my mind that I bring up to other students when they're thinking about coming here is, I am not going into surgery, and I'll never be a surgeon, but I feel like surgeons have a tremendous ability to care for patients in a very, very dire time, and some are more skilled at that than others. When I was during my general surgery clerkship, I was working with Dr. Travis McKenzie, who's an endocrine surgeon here, and he was actually honored at our graduation for being one of the
Oh,
educators of the year. So he was a good person to learn from. But we had a patient that was extraordinarily nervous to have a thyroid surgery, where one of the risks is vocal cord paralysis, so being able to not to speak. And I just remember Dr. McKenzie spending like 45 minutes with the patient and answering all of his concerns, where he didn't have to do that. It wasn't going to change any of the outcomes, and Dr. McKenzie's a very skilled surgeon, but to that patient, it really made a difference. And I just remember seeing him do that and saying like, wow, this, I don't know if this happens other places. I really hope it does, but that was one of the wonderful things.
Tell us about your work with the Somali Health Advisory Committee.
Yeah.
That's kind of a far-flung question,
well,
but that's what I've got about you.
Yeah. So I think that as medical students, we do get involved in the clinic, but a lot of us also get involved in the Rochester community. And one of the things that I got involved with was the Somali community in Rochester. Minnesota is a very vibrant Somali community. And I got to work with other Mayo Clinic employees from pretty much all backgrounds, very laboratory tech, respiratory therapy nurses, and it's just a group of mainly Somali Rochester citizens and Mayo employees who care about Somali health. And so one of the things that we worked to do was do health fairs at local mosques. So as a medical student, I brought a little bit more medical knowledge. We did career fairs for Somali students that go to the Rochester STEM Academy to talk about medicine and science, but also like law enforcement and going into professional fields and things like that. And so being a part of that community was wonderful. I think it really connected me with the Rochester community, and it allowed me to get a little bit outside of the Mayo bubble, which was, I think, refreshing for me during medical school.
Can you tell us a little bit more about just Mayo Medical School's relationship with the community as a whole in Rochester?
Yeah, so I think there are definite ways that medical students get involved. One of them that every medical student does is they volunteer at the Good Samaritan Clinic at the Salvation Army. The second-year medical students with physicians staff a free clinic there for anyone who's in Olmsted County who's uninsured or underinsured and provide care, and free of charge, and a lot of medicine free of charge as well. I got involved in the Somali community, and that was kind of my niche. One of my classmates who's in family medicine as well, Lauren Carlson, got really involved in the Hispanic community here and did some free translating at different clinics around, and also was really involved with a project to work with improving diabetes outcomes in the Hispanic community in Rochester. Those are some things that I think of off the top of my head. There's a lot of students who are doing a lot of great stuff. And I think that the Rochester community is an excellent community. I mean, it's a small town, but it has a tremendous amount of diversity. So as a medical student, I got to learn from that.
Finally, why don't you tell us about your residency? You've graduated now, you're a doctor. What are you going to do next?
So I'll be going to North Memorial Health Hospital in North Minneapolis. Family medicine, 3 years.
Also a large Somali population.
Yeah, so there's a large Somali population. The main there's a lot of African American in that population as well. And I'll be working. It's a University of Minnesota affiliated program of 7 other co-residents, 3 years, all at that hospital. And there's a clinic in North Minneapolis as well. Really excited, family medicine, learning a little bit about everything. So we'll see how it goes, but I'm just really excited to get started and continue to progress.
Very good. We've been talking with Dr. Paul, Doctor. I really should emphasize that for you.
Thank you.
Dr. Paul Stadem, the recipient of the Minnesota Academy of Family Physicians 2018 Medical Student Leadership Award. Thanks so much for joining us, Dr. Stadem, and congratulations.
Thank you very much. Appreciate it.
Best of luck as you head off to residency.
Thank you.